On behalf of Southern California Public Radio, KPCC, welcome so much. Thank you so much for coming today. I'm Charlotte Duran. I'm a producer here at KPCC. And for those of you who are unfamiliar with KPCC, we're an NPR affiliate based in Pasadena. We're also a multi-platform organization. We're on the air at 89.3. We're also online at kpcc.org. And we also do live events like the one you're at today. So if you haven't been to a live event before, please check out our website. You can see all the forums and events that we do throughout Southern California. That's, again, kpcc.org, and our events are /@inperson. Today, we're going to have a great conversation about air quality and pollution and how that's affecting our health. Just some quick housekeeping notes. We are live streaming this event. That's on video. So if you have flash on your camera, on your phones, please turn that off. We'd love for you to be tweeting about this or posting on Facebook, so feel free to do that. You can connect with us at KPCC in person, and the hashtag we're using is #airquality. I'd really like to introduce our public engagement editor, Ashley Alvarado.
Hi, everybody. Thank you very much for coming out on a Sunday afternoon when it is sunny and pretty outside. I am the reason that you have a paper on your chair. And if you don't, I don't see any pencils out. So if you grab it and on your way out, stop by the table that has pens, which you can keep. I would love for you to take a moment to just put a little bit of information down on here. One of the great perks of my job is that I get to work with community members as news sources. That means we ask you to share a little bit about yourself. It could be the part of town you live in. It could be that you're interested in issues like air pollution. It could be that you're a parent or you make your own tortillas. It could be anything you feel like sharing. And if we're doing a story related to that, we might reach out to you with a quick set of questions via email. Or if you've said something that's super on point with what we're looking for, say you own a car dealership in Montebello, and we're trying to find Montebello car dealership owners, we might give you a phone call. So again, if you have a time to just fill it out, it's very brief, and I promise I don't bother you that much. Thank you.
And now I'd like to introduce today's host. That's KPCC's Early Childhood Development Correspondent, Deepa Fernandes.
Hi, everyone. Thanks so much for coming out today on a Sunday and a Sunday afternoon at that. I'm especially appreciative to our panelists for making the time, so let me introduce them and bring them up. Our first panelist is Lou Calanche, who is the founder and executive director of Legacy LA. Yes. Really great community organization that works in Boyle Heights that really services the Ramona Gardens area. Our next panelist is Scott Chan, and Scott is with the Asian Pacific Islander Obesity Prevention Alliance. Thank you, Scott. They do a lot of work in the San Gabriel Valley and East LA region. Next, we have Dr. Jim Gorderman, who is a professor at the USC Keck School of Medicine. And Dr. Elisa Nicholas, who is the founder and executive director. She's a pediatrician of the Long Beach Alliance for Children with Asthma. So please join me in welcoming them all. And just how we're going to do today is we're going to have a conversation up here with the panelists for about 45 minutes to an hour to leave plenty of time for questions. This is kind of your one-stop shop for questions and answers. If you have concerns about your child, as you may know, and you're probably here today, we have been looking at KPCC at the impact on children's health of going to school, particularly preschool, very close to major roadways. And these four folks up here have all been very instrumental in helping us with the research and the reporting. But before we begin today, I just want to take a moment to remember our colleague at KPCC, Steve Julian. Some of you might know him. He was our morning show host for many years, and he was a beloved voice and a trusted news source on KPCC. And very sadly, he passed away this morning. So I just want to take a moment to dedicate today, and he's had a very big influence on my reporting, and to all of our colleagues at KPCC, and to his wife Felicia, this is a very, very hard day, so just wanted to take a moment to remember him. Okay, so air pollution and little children. We came to do some of this reporting as we began to, like we do as reporters, we get press releases about new studies that have come out. And it actually really started when we got some positive news that came out of the USC Keck School of Medicine that said, well, kids' health is better today because the air is cleaner in Los Angeles. And that study came from Dr. Jim Gorderman and his team at USC, at the Keck School of Medicine. And it caused us to say, oh, that's interesting. So what was happening and what still is happening? So I want to just start today, Jim, by asking you to just set the scene for us, because I think, we look out the window, I don't see anything that looks dangerous or something that might not be good for my own little children. Yet your research, going back well over a decade, has found that indeed there are pretty serious health impacts.
Yeah, well, first off, thank you, Deepa, for organizing this town hall. And I know it's a sad day for KPCC, so, but we'll forge on and talk about exactly what you talked about. So, for those of you that don't know, we started a study a little over 2 decades ago at USC to study how air quality or lack of air quality in Southern California might be affecting children's health. And over the majority of that time, we found detrimental effects of air quality, air pollution, on things like risk of asthma or increased coughing and bronchitic symptoms in kids that already have asthma, or even decreases in lung development in kids as they age through their teenage years. Fairly important long-term consequences of Southern California air quality on children's respiratory health. But because we were studying kids over this 2-decade period, and because, very fortuitously, a lot of important policies were put in place in Southern California and more broadly in the country to try to improve air quality, we were able to study kids that grew up back in the 1990s when the air pollution was a little worse, and some kids that grew up in the late 2000s when the air quality had gotten better. And by comparing those two cohorts of kids and looking at things like asthma, respiratory symptoms, and lung development, we were able to document in some recent work that just came out last year that indeed these improvements in air quality that Deepa just mentioned did have significant impacts on improved respiratory health in these children. Now, I want to caution that we have a nice day out today, and generally we have very many fewer high pollution days. But a recent report that just came out a couple days ago still put Los Angeles at the very top in the nation in terms of poor air quality. We still have some of the highest levels of particulate pollution, and we lead the nation in ozone pollution. So there's still a lot of work to do. We still are not in attainment for particulate levels, for example, and these are the kinds of pollutants that we still see are related to adverse health effects in children. So there's still a lot of work to do.
And we're going to be breaking down what those adverse health effects are. I think, I didn't know what reduced lung functioning meant and how critical that is to ongoing health into adulthood. But Jim, what is particulate matter? We all drive on freeways. We're all coming. Can you give us a sense of what it is that is coming out of cars?
Yeah, so what comes out of the tailpipe of cars and trucks includes particulate matter, and these are very small fragments of particles, little bits of dust and soot, et cetera, that come out of the tailpipes, and then a whole bunch of gaseous pollutants as well. And so if you live or you go to school or you work close to freeways, you're being exposed to very high levels of these kinds of pollutants if you're very close to these roads. Now, what happens to these pollutants as they come off the roads is the particles start to coalesce, they form larger particles, The prevailing winds that we have in Southern California, as you know, are kind of off of the ocean and they blow towards our eastern valleys. So by the time the air mass comes across and gets into some of our eastern valleys, the particles have grown, they've become larger, and we have some of the highest particulate levels in the country in those eastern areas. They're inheriting a lot of that air from the busy urban areas in the ports of Los Angeles and Long Beach, in addition to a lot of roads and things that we have out in those inland valleys.
And I remember you saying, I think it was when you testified before the city council a decade ago maybe, that these particulates are so dangerous that the EPA actually monitors them.
Yeah, so the EPA has several criteria pollutants that they monitor. It includes two kinds of particulates called PM 2.5 and PM 10. That's just based on the size, 2.5 microns or 10 microns. Both of them are respirable, breathable into the lung, and both have been demonstrated to show adverse health effects. So yes, the US EPA does monitor those. They set standards for those on a regular basis, and unfortunately, Southern California is generally out of compliance in some of these polluted areas for those pollutants.
And with fine particles, the closer you are to a freeway, so at KPCC, your colleagues at USC advised us 500 feet, which is about one kind of really long block. 500 feet is kind of the area that you really need to be concerned about. But the city council we saw in LA just passed that they looked at regulations for new housing and air filtration systems. They used 1,000 feet. Does it matter, and how much does it matter? Like how much further away you get, how much better it gets?
Yeah, so if you think about these particles and gaseous pollutants that are coming out of the tailpipe, they're very high near roads. And many of these drop off fairly substantially as you get away from the road. So if you are 100 feet away from the road, that's a lot better than being at the road. 300 feet is even better, and the further you get away, the better you are. You get out to about maybe 1,500 feet or so, and you're starting to kind of back to background levels. It's fairly flat. So anywhere within that, say, 1,500 feet border, you're going to have very steep declines, and the further you can get away, even by an extra 100 or 200 feet, you're going to have significant decreases in the exposure to those direct kind of tailpipe emissions.
Okay, so it's not good. We shouldn't be that close. We should not be breathing them in. But it's worse for children. Is it right to say that their bodies and are less equipped to deal with what's coming out of tailpipes?
Yeah, so the two kind of susceptible populations that we have in general are the youngest and the oldest people. And the youngest ones, because their bodies are developing, their lungs are developing, their brains are developing. And as those body systems are developing, it's been shown that breathing in pollutants can have adverse effects on the lung, on the cardiovascular system, even on the brain as the brain is developing. And the same is true on the other end of life. So for older adults, it's been shown that exposure to traffic-related pollutants is associated with premature mortality, with increased risks of respiratory and cardiovascular disease. And so, on either end of the age spectrum, we have our most susceptible individuals.
Dr. Nicholas, you have worked in Long Beach for years and years with the very susceptible population that we're talking about, and the name of the group that you founded, an Alliance for Asthma Prevention. It says it all right there. So I wonder if you could just put into a little bit of context. You're a pediatrician. You're treating patients, but your team is also working with them. What does that present as? How are kids coming to you that might be linked to traffic pollution?
Yeah, so my full-time job is the CEO and pediatrician at the Children's Clinic serving children and their families. And we are a system of community health centers in Long Beach and Bellflower. And we serve 1 out of every 3 low-income child or family in our community. And I've been there for 28 years. So I've been seeing patients for all that time. And when I first started, I would go over every admission that we had from our children's clinic when we were much smaller. I would see how many cases of asthma came in, went to the emergency room, and then were admitted. And we knew we had to do something about it. We knew we had to do something about it within our clinic system and how we responded to that child the minute they presented to prevent that admission, make sure our doctors were treating them appropriately. But then we also knew that we had to do something in the community. So we first started using community health workers at the Children's Clinic through a California endowment grant. And then we applied and were selected to be one of the Allies Against Asthma national one of 8 sites at the time, to really look at a community-based socio-ecological approach to childhood asthma, where you look at the child in the context of their family, in the context of the health system, but also in the context of their community, and really looking at policy and environmental changes. And that's how we started at La Baca. We had different areas. One was working with the schools and still is. One was working with the physicians to educate them in the entire community, not just the doctors that work in my system.
And is that because physicians might not necessarily understand the kind of the environmental impacts on why children are presenting with certain?
It's both. It was both. There were new guidelines that came out in around the mid-90s from NHLBI and the asthma recommendations on how physicians should treat them, and there were studies done, and many doctors weren't following those. They weren't identifying all the cases of asthma. They weren't using enough long-term medications, like inhaled corticosteroids. There was some steroid phobia. They were using sometimes the wrong medication. They weren't educating about triggers. And then we knew about the indoor air pollution and the outdoor air pollution. We started working early on with the USC folks. Serendipitously, I met at Aval's wife, and she hooked me into them. I'd heard about Dr. Peters' work already, and so we were thrilled to be able to work with them. So I think it was part of just to get them to identify and treat and make sure they had the equipment to actually understand their asthma, but to take the right medications in the right way at the right time. But then to go upstream and see what is triggering their asthma and what is actually causing their asthma. And those were the policy and the environmental, both indoor and outdoor. So there were policy issues that we looked at early on, just about getting the medication and getting 2 spacers and 2 medications in case you were at an aftercare and, or a father's house instead of the mother's house. So access to medication, understanding what it was, but then looking at the triggers and the causes of childhood asthma. So really kind of a holistic socio-ecological
And
approach.
just set a little bit of the scene. Long Beach is right, obviously the ports are right there. The 710 comes up from Long Beach, and I'm sure most of you have probably driven that at some point. I think when I started doing this reporting was the first time I actually started paying attention to the freeways and to what was driving on either side of me, and noticing where there were more trucks. And a lot of that was coming up when, we would come down to Long Beach. There were some preschools there that we were looking at. We'd get on the freeway, we'd be driving back up, and all of a sudden we were surrounded by trucks.
Yes. And early on, so Long Beach is a wonderful place to work, but it has a lot of issues that we need to work on and have worked on in partnership with many people in this room. So we have the 710 freeway, we have the 91 freeway, we have the 405 freeway, we have the port, we have the trucks, and the trucks were a huge issue. Both in the port, all the vehicles that moved things around the port were all polluting, and those are now clean electric. Correct me if I'm wrong. And the trucks were idling for hours when we first started. And Andrew Rico's in the audience here. There were bills passed by Congressman Lowenthal, who was an state assemblyman, put forth a bill so that the trucks wouldn't idle at the port. So they would come to the port and they would be there for hours, just idling, creating pollution. So we changed that. And then there were the efforts to clean up the trucks. So I think there are a lot of points at which we could have some profound impact, and we didn't certainly do it alone. We were just there. We were the voice of health, the voice of reason, the voice for children. And I think one other thing that Dr. Gottman didn't touch on is the children are developing, and these are critical periods, especially the first several years that, with kids in preschool. But also they get a higher, it's that their lungs are developing and their brains are developing, and they're developing in general, but they also breathe faster. So their minute ventilation is higher, so they get a higher dose of the pollutants in the air. So I usually talk about both those issues, so I just wanted to clarify that.
They're more likely than us older folks to be outside exercising
That's right.
and playing
That's the third one.
and breathing whatever is in that
Yes,
outside
and for
air.
those of us who have toddlers, we know they don't walk anywhere.
No.
They run.
They
run everywhere.
They do.
So let's bring in our other panelists. Scott, the work that you do really focuses on schools that are situated very close to freeways. Can you just set the San Gabriel Valley scene for us?
Sure. So, hi everyone, my name's Scott. I work for a nonprofit called the Asian Pacific Islander Obesity Prevention Alliance. And I think when I tell that to people, one, it's called APIOPA for short, let's make it easy. But I think when I tell people, they're like, why are you working on air pollution? Shouldn't you just be telling people, what to eat, how much to exercise? But I think for us, it's really about environment, right? So let's say I'm telling people to go and exercise, but they're exercising at a school that's directly next to a freeway, right? We've had students come up to us and say, is it better to exercise in bad air or not exercise at all? Right? And what do you say to youth who ask you that, right? So for us, we were seeing that in the San Gabriel Valley, there's a lot of advocates in the different areas of like Long Beach, and around the ports, LAX, East LA, but we weren't seeing a lot of folks doing San Gabriel Valley focused advocacy. And we were seeing that, there are dozens and dozens of schools that are way too close to the freeway. The 10 and the 60, I went to Glen A. Wilson High School. When I ran the track, I would count the trucks, because you had to run the mile, and we were within 100 feet of the freeway, right? And I think right now we're working at Marquette High School, and that school is 50 feet from the 10 freeway. Part of that school, the wall was broken, so you could actually see every single car on the freeway. So I think for us, we're seeing that, as we're talking about health of our communities, there's all these schools located so close to this freeway. And people are running track, people are exercising, they're doing PE and all these other things. I think for us, we're trying to figure out how do we work with the community to solve this.
And I think it's interesting because, and you may have heard this in your work, but I heard a lot doing this reporting, and from younger people too, but if my school's here, it must be okay, because, adults wouldn't make bad decisions like that. They wouldn't put us close to a freeway where it's not good. At the kind of the young end to, when I was talking to parents whose children were in preschools, it must be fine because everybody else is sending their child here. So if it was really that bad, then why, they wouldn't let us do it. They wouldn't let the schools be here. Do you hear that, and how do you respond to that?
We definitely hear that from students, and we also hear that from parents, because the parents say if it was so bad, they wouldn't let this happen, right? This wouldn't be a reality. And I think for a lot of the youth that we work with, they just don't have an understanding yet of what air pollution is. That's not a high concern for a lot of communities of color right now. We've actually worked, I remember this very well, there was this student we work with in Chinatown, and he was telling me, like, it's great that we're so close to these freeways because now my lungs are stronger than other folks. And, he was very serious when he said that, and other folks, I think, believe that too. So I think there is a lot of community education that needs to happen.
How do you burst the bubble on that one?
Yeah, it took a side meeting with him and just a bit of community education on that one.
Yeah. And Lou, the community that you're from, that you grew up in, that you work in, a lot of people don't have choices. They are sending their kids to school. They are living themselves right by the freeway. Can you just give us, like we've now heard about San Gabriel Valley, tell us about Boyle Heights, set the scene of what it's like in East LA.
Sure. I'm the executive director of an organization called Legacy LA, and I'm also a professor at East LA College. And I grew up in Ramona Gardens, which is a community surrounded by not just the 12-lane 10 freeway and the Metrolink, but on the other side, on the other side, there's a rail line and then industrial area. So the community is surrounded by pollution, both mobile and stationary pollution. And Boyle Heights has...
You mean trains are not clean?
Yeah, and I actually learned from the youth that the train emission is sometimes even worse than the car emission. Yeah, so they get it on both ends. But growing up, I actually thought it was good to live next to a freeway because it was like very accessible, right? And Boyle Heights has 4 of the main freeways that cross through it, and they're not crossing through open fields, they're crossing through neighborhoods. So people are not just going to school, but living in these polluted areas. Our work in Ramona Gardens started because I was providing a tour of Ramona Gardens, which is one of the oldest public housing developments in the city. and the freeway is steps away from where the kids live. And unfortunately, the bedrooms are on the upper level where they can see the freeway. So as I'm learning about like how the emissions and particulate matter travels, it's going into their windows, into their bedroom windows. But I was showing, actually a reporter, I believe from KPCC, this is about 10 years ago, a new playground that just opened in the development. And she noticed that the playground was steps away, I guess, from the 10 freeway. And that was the first time I actually realized that there isn't any concerted effort to create policy, like health policy, when it comes to like making decisions about where schools are or where playgrounds are built, eating areas. I remember like Soto Street Elementary School also has like their eating area right next to the freeway. So that's kind of the environment that we grew up in, and there was very little awareness about air pollution or the impacts of it. And many times, because you hear about all the other problems that are going on in poor communities, that people do not understand. There is an awareness, but also it's not a priority to think about things that they're not feeling at the moment.
And it's invisible.
It is, you can't see it. Yeah, so through our youth leadership program, it was even work to convince them that this is a problem that they should tackle. Because we kind of did a neighborhood assessment of different problems, and they could see maybe alcohol abuse, or they could see other issues, but you couldn't see the contaminated air until they started hearing from the professionals and what the impact of living next to a freeway is.
I mean, it was in some ways stunning to me when I went back to like Dr. Gorderman's 2004 study and read from that, and then again in 2007, and then presentations before the city council, and there were city council people who got up and then to kind of fast forward to 2015, 2016, and doing this research, and it just seemed like, you know, is it not being actively moved on because you can't see it?
Yeah, I don't think so. I think air pollution awareness has always been a situation here in Los Angeles. We've always topped the list for bad air quality. I think people do know that the air is bad. Yes, it would be a lot easier if you could see the smoke and see it kind of how it transferred across countries, across communities. And what you were actually breathing. So, you know, that is a bit of an issue. But there's been so much health research over the last 2 decades, not only from us at USC, but across the country, across the world, that have been linking emissions from roads and trucks and cars with a variety of health impacts. So, you know, I think at least in the scientific community, the word is out there. I think through the efforts of reporting agencies around here, including KPCC, getting the word out, and then community groups that have really taken up the charge in the Southern California area, in Long Beach, and some of the inland valleys. You know, I think we're doing a pretty good job at trying to get the word out and trying to make it clear that there are health impacts.
Yeah, I mean, I remember that I was with your colleague, Professor Ed Avol, and we were at one preschool which is at an intersection. It's in East LA. It's at an intersection where like 3 freeways cross and snake around each other. And the preschool was literally, the off-ramp comes off of one of them, and the preschool was right there. So we were standing right out the front. And it was a stream of trucks coming off at the time when we were there with Professor Avol. And there was a construction site, because they're broadening the exit or something, right? So there was a construction site. It was noisy. There was they were drilling in the ground, so stuff was coming up. And it was really interesting because for my colleagues and I who were there, we were like, oh, this is awful. This is, and he literally said, he was like, that's not the worst part. Like, you're looking at a construction site that's problematic in certain ways, but look at these trucks coming off, driving literally right in front of the preschool. And it kind of was this moment of like, oh, well, why am I horrified by that? But I'm kind of blind to these trucks just driving right by. And then he, from there we started looking at, well, what, and Elisa, you were talking about, going to the ports to say, can we make trucks cleaner is one solution to this. Can you tell us a little bit? Because when you first went down to the ports, they thought you were crazy.
Well, I think in general, when we first started talking, when Labaca was founded in 1999, it was a national effort. So as I said, there were 8 sites selected initially, and 7 of us got the continuation funding. And I would talk about outdoor air pollution because of the work that I knew that they were doing at USC. So I had kind of the inside track because a lot of it hadn't even been published. And I'd keep bringing up outdoor air pollution. And these were the experts in asthma in the whole country. We had some of the leaders in childhood asthma, and they didn't pay much attention because the data wasn't there and it wasn't repeated over and over again like it is now, and so there wasn't that education that came out. And when I first went to the port, I talked about asthma and health and air pollution and what the ports were doing, and really they looked at me like I was really a little bit off. And then, the data started coming out. KPCC and National Public Radio started picking it up. LA Times had one writer. I remember the day the article came out because I was at another hospital event somewhere, and I was like, oh my God, this is amazing. They're talking about this. And then article after article. And I think to change the political will, you have to change the knowledge base and get people activated. And for people that read the newspaper and listen to the radio, those are the best ways to do it. So I've seen a profound change. Now, when you talk to the ports, we don't want to hurt the health of our community, and we're committed to not hurting the health of our community. And it's really because of all the work that was done in Southern California and many of the people in this room. And it was quite rewarding. And then nationally, they started recognizing it too, and all the goods movements and the conferences we had. So really, it was an amazing thing to watch.
Scott, you have brought some fun show and tell stuff that I got to spend some time with Scott and go out. They work in high schools trying to help young people understand what air pollution or traffic pollution is. Do you want to maybe just show us what you brought and explain how it works?
Sure. Maybe to that last point, I think it's really important that we're addressing policy upstream because, the ports, so many trucks and things are coming from the port through our communities. If you're on the 10 or the 60, they're projecting more and more trucks are going to be coming through our communities, maybe double in the next 10, 15 years. So I think it's really important that we address those policies. So what I have here, this is a low-cost air center. I think they made it look like a cute frog. Kind of looks like a cute frog. What this is trying to make data available to low-income communities, right? So usually, I think there's another air sensor here, but that P-track is thousands of dollars. This is about $300. What it does is this measures PM particulate matter 2.5. I have it on right now, so I've been measuring air this whole time. But I will tell you, when I started earlier, I've been measuring air in the library, and then I went outside, and it spiked maybe 10 times higher outside. So once I took this and walked out the door, the particulate matter levels went really, really high. So there are some issues with low-cost air sensors. I mean, you're not going to get the same accuracy as something like the P-track, the really expensive sensor. That also measures different particles, but this is a really good way of educating community members about, just to understand what is air pollution, what is the differentials in all the different communities that you're working in. So what we've been doing is we took the students, we taught them how to use this. It connects to any Android phone, no iPhone, surprisingly, only Android phones, which actually is really hard because every student has an iPhone now. But we connected it, and then they would plot out maps of their school and times of when they want to go out and measure the data. And they would see, like, hey, what we found from one of our measurements is that the inside of a science building has the same air quality as the outside, right next to the freeway. And that helped us figure out that the filters are not the right filters for that building, right? So it's actually just sucking in all the bad air and just spinning it into the building. So it's been a really, really educational tool for just trying to figure out, like, where is the bad air pollution at the school, just like pinpointing it, but also just opening up conversations of why is the air so bad at a place that we should feel safe at.
And I think we have a representative of the AQMD, Philip Fine, who, I would like to get you to talk a little bit about, we'll get a microphone in a sec, but the AQMD has actually done some really interesting work, and actually, Lou, you can talk a little bit to air filtration and what happened in Boyle Heights.
Sure. So our youth leaders that live in Ramona Gardens took up the environmental justice issue that they lived in this community that was full of pollutants. They were breathing in day and night, in school, out of school. They were breathing in this polluted air from the freeways, from the trains, from the factories. And they started doing some research, talking to different folks about what could be done. They learned about weatherization. There's actual homes that the backyard is the freeway. So we talked about weatherization, and they also learned about air filtration. And we thought about, there's like a lot of work happening around like policy changes, but what about immediate changes? So they decided to take on the issue of trying to get air filtration system at the elementary school, which is right in the middle of their neighborhood. And these kids are high schoolers, so they weren't even worried about their breathing. They were worried about the elementary school in their neighborhood. And they met with AQMD and advocated for the installation of an air filtration system. And it was really expensive because the school had 4 buildings, and AQMD said, oh, this is kind of a really big project. Maybe we could do a smaller facility in the neighborhood and not the school, because it was a pretty big project. And the kids said, no, we want the school. And their logic was great. I mean, they believed that the kids are here from 7:30 till 3. This is where they spend a majority of their day, and this is where they're learning. So they really wanted the school, and AQMD agreed to pay for the installation of the air filtration system in 4 of the buildings, which that's why the project was so expensive, at Murchison Elementary in Ramona Gardens. And we've already heard anecdotally, I mean, because we don't have any research, but the teachers are telling us that the air is cleaner, there's less absenteeism because kids are not getting sick. So we feel that it was a huge victory for at least the elementary school kids in the community.
And I should have said the AQMD is the Air Quality Management District. I think what's really interesting, and Philip, maybe you can speak to this. Just stand up. So one of the things, one of the preschools that I went into, they said, we have air filtration systems that, and I think they even said they bought them at Home Depot, but they don't have, they called, the high power ones. Can you tell us a little bit about air filtration systems? Because your team really did the research and developed some things.
Yeah, so again, my name is Philip Fine. I'm a Deputy Executive Officer at the South Coast Air Quality Management District. And going on maybe 6 or 7 years ago, we started some projects looking at how well filters in your heating and air conditioning system actually can filter out some of these freeway-type pollutants or roadway-type pollutants. And it turns out that the typical, maybe cheaper filters you might buy at Home Depot or Lowe's or any hardware store, they're okay at the larger particles, but the smaller particles they cannot filter out very well. So we did some pilot studies down in the Long Beach area and worked with one company that was making high efficiency filters, and they're much more expensive than the $6 filter you get at Home Depot, but they're very effective at filtering out the smallest of the particles, what we call ultrafine particles, or that diesel soot particles that the regular filters can't filter out. So since that time and some other studies, we've put filters in over 60 schools in Southern California, including Murchison, several down by the ports, all the way out to San Bernardino and Coachella Valley. So the program has been pretty successful. Wish there was enough money to give every school those filters, but there just isn't. It does get very expensive. It's not just the quick fix. It's not just the filter. Even though these new filters might be $100 instead of $6, you also have to look at the whole air conditioning system, make sure the building envelope is tight so stuff doesn't leak in, and then other types of things with your thermostat to make sure that the air continually flows. So we learned a lot doing it, but we've been very happy with the outcomes.
Thank you. And I spoke to one preschool director who, when I said, do you have an air filtration system? Their preschool is very close to a major freeway. And she said, oh, yeah, we've got our air conditioner, our AC system. And, I didn't know any better, so I went away and kind of just Googled, does an air conditioner block out? Can it serve as an air filter? And clearly the answer was no. But I think, we don't know these things, and we believe that we're actually it actually is doing what it's doing. Just to put a cost on that, so that it's kind of, it was like $400,000.
I guess each system is about $100,000. I'm assuming, because we did four buildings at Murchison, so it's pretty expensive. Yeah.
Yeah, and Scott, you said that the schools that you've worked in have also tried to get the air filtration systems, but have not been successful.
Yeah, I mean, we asked, and it was quoted at, $500,000, and then we were asked to try to find the money ourselves. And I think the school district didn't have that kind of money, and the community we work with also don't know how to get $500,000. So it's tough. I mean, I think it's great when we can get that to happen, but how do we make it in a more affordable way? And then also, I guess the question is, how do you upkeep it? After you have a $400,000 or $100,000 system put in, what needs to happen to make sure that it keeps functioning?
Jim, let me just ask you, other kind of short-term mitigation. So one preschool that we were at, actually a couple of them, had amazing green shrubbery, like tall trees, and it blocked out a lot of the noise. You almost didn't feel like there was anything. Did trees help? Is that a solution?
Yeah, so trees will help a little bit. They do provide a surface for some of these larger particles to cling to, so they can end up reducing some of the particles. They're going to change the airflow and et cetera, and maybe result in slightly cleaner air outdoors at a school that is surrounded. Not going to be very effective at filtering out the ultrafine particles, which are the kinds of particles that come directly out of the tailpipe, and they're not going to really do much to these gaseous pollutants. So, if I had $100,000, I'd put my money in the filter, not in the a lot of trees. It's just not going to be a really effective solution.
Again, though, that's only when you're inside. So when kids are outside playing, and so then it's like, is a solution just don't have the play yard right up against the freeway? I mean, it could be a matter of 100 or 200 feet, but move the outdoor play yard, because I think one of the things, and for those of you who may have young children, drop-off and pick-up times are very commonly times when kids are playing outside, because you can't start circle time, or you can't have everyone on the mat because kids are coming and going, parents are dropping off, some kids are crying, so playing outside is a very common strategy. And I think when I started doing this reporting, having covered early childhood a lot, it was the first time it really dawned on me that, oh my gosh, there are like cars sitting on the freeway right there and all these kids playing right here, and then when the kind of peak hour traffic drops off, kids are going inside. It's kind of contrary, like.
Yeah, very contrary. And being a former cross-country and track runner, when do you run? You run in the afternoon after school gets out, right when the traffic picks up. So, and you usually run along busy streets. So yes, I mean, if a school has the opportunity to put their play equipment or their exercise facilities 100, 200, 300 feet further away from a busy road, or to have the kids move to the further area of the play yard to do the exercising, that is an improvement, and the exposure levels will be quite a bit lower. Recognizing, of course, that a lot of places don't have that opportunity. So then you get into the kind of trade-off that was mentioned earlier about exercising outdoors, which we know is good for kids, good for obesity, et cetera, versus the kinds of air pollution exposures that those kids might be having. And that's a difficult question.
Elisa, when we met at one of the preschools there, I put this question to you, and I said, so, if you don't have the choice of, because you can't afford private preschool, you can't afford to choose where you put your child, so you're sending them to the local Head Start or state preschool or subsidized childcare, and it's situated in a bad place. What's the decision process here? As the pediatrician who's on the front line of seeing kids get impacted by that, should mom and dad keep them at home instead of sending them to get an early education?
Yeah, it's something I've struggled with for probably 2 decades, thinking about this. And I think it's very important for children to be in early childhood education. I think early Head Start, the earlier you can get children in, probably the better. And it's almost like a Sophie's Choice. How do you choose? You want the parents to be able to take their child close because it's more convenient for them. And the one we were looking at is within a housing development for the formerly homeless. It's a beautiful, it's a beautiful location where they have all these services co-located. So they could just, some of them can walk their child right over there. And it's important for those parents so they can, one, work, but so that the children can have very enriched environments. So I think, to me, I said to you, let's close this freeway that is right there, which I think is going to happen probably. We're hoping within the near future, because there's been a lot of effort and a lot of awareness raised. We all went to their visioning meetings. I'd run into my SC colleagues. So let's clean up the trucks that are going back and forth there, and let's make sure they get air filtration systems, because I think it's going to be hard to locate them all in areas that aren't close, because our families that we serve are living close to the freeways. I mean, there are not a lot of choices. I was being interviewed by Univision the other day, and they said, well, why don't you tell them to move? I'm like, where can they move to? I mean, they need to live in these communities. They work in these communities. Their friends and families are in this community. So to suggest that people can just pick up and move is very difficult. So I always try to make sure that they maximize everything. Do they not have mold in their house? Do they not have old rugs? Take them out. Do they, know how to control cockroaches and dust and things in the indoor environment? Are they taking their medication right? Are they eating well? And are they exercising? Are they controlling their stress? Every piece that we can have some influence on is what we try to focus on. And there are a lot of different things that can all make children, and especially young children, healthier. Are they talked to, read to, and held? So there are all these things that also influence your immune system that we know, which is also influenced by pollution and other things. So,
And I think, Lou, the parents that I spoke to in doing this reporting, parents who had means were able to make a choice to move their child. And parents who didn't have means were kind of fell into the group of, I'm also worrying about all these other things. And to some degree, it was like, it didn't even seem like, maybe it was me bringing the news to them about, are you concerned? Look, there's the freeway. Are you concerned that your child is going here? What is the solution, when you are in the situation that Elisa just described, where you have so many other things, and now someone's telling you, oh, your child's going to school by bad air?
Right. I mean, there's so many different issues and even health risks that they're thinking about that are common things that they're dealing with. Poverty really has an impact on health and the things that people worry about on a day-to-day basis. So you're right, people aren't thinking about air quality, and sometimes it's kind of at the bottom of the list of things that people are worrying about. People are worrying about paying rent and, survival. And I think that one of the
So where does this rank then in that? Like, should people worry more, or really is it down here because paying rent and getting food on the table is a daily survival issue?
Well, I think it's an awareness issue, because I don't think that if parents, like this show is actually pretty amazing. I wish we could bring it into the community, because I think that once people are aware that it's not healthy and the health risks of living next to a freeway, it's kind of hard to not think about it. And that's when it starts bubbling up as a community issue that folks might want to do something about. I see other communities, like the work done around Exide. It took a community to push the policy to close down the Exide factory. So I think that bringing the issue to the community, exposure, I have a lot of my students here that are going to work on environmental justice, where it's something that we're not thinking about. Because we're thinking about, how do I get my kid into college? How do I help them graduate? How do I help them, not, get into trouble? So I think bringing awareness is really key. The issue then would be, like, once you're aware, what can we do about it, right? And I think that's when we start organizing. And I think there's a lot that has been done when you start organizing communities, but people have to understand the risk. Our youth, when they started learning about the impact of the ultrafine particulate matter on their brain and lungs, they actually thought, oh my gosh, this is probably the most important issue we need to work on. But not until they understood that did they really think this is something we need to work on.
And I think that kind of gets us to, so we talked about some mitigation strategies like air filters and trees perhaps, or moving your child if you can, or moving yourself if you can. But when I was doing this, it became clear to me that the air is cleaner today because of some environmental victories that have led to some significant policy change. And I wonder if any of you can, maybe just talk us through one that you know of, and maybe it's the clean trucks at the ports. Like, how does that happen? Is that a struggle? Or can we just say no more diesel trucks because diesel particulate matter is way worse? I mean, is, closing a section of the freeway, I remember when you said that to me, I was interviewing Elisa, and she pointed to the freeway, she's like, yeah, they're probably going to close that. And I just thought, close a freeway in LA? Like,
And make it a park.
And make it a park. How is that happening? And then I
With
went.
fruit trees.
I went to the Long Beach City Council meeting, and I sat there and I listened to the back and forth. So I wonder, like, bigger solutions.
I think one thing we haven't touched on is the technology, and I think some of it is having the technology to advocate for and to have it be low cost, like they did with the air filtration. So I think there's that piece. The one piece is developing the technology, changing the political will to actually implement some of those technological changes. I'm not the expert on that. I think Dr. Gautam, I know Ed Aval is really good at talking about this technology.
I think it is a really broad-based approach that has to be taken. And if you look at the kind of policies that have been put in place over the last 20 years, it's really affected the cars we drive, the trucks, the on-dock vehicles that move the cargo around, the ships, the trains, the point sources, et cetera. And really, as a collective policy solution, that is really what's made our air 50% cleaner on some of these pollutants today than it was back in the 1990s. Really been quite amazing. And that's in the face of more traffic, more economic activity, more population that has happened kind of over the last 20 years as well. So it's a huge, in a sense, environmental victory. And that's really exciting. I think, we can, as communities, we can encourage our government officials to remain diligent, to continue to think about air quality issues when they're proposing bills, either at the state or the federal level. We can vote with our pocketbooks, so you can buy cleaner automobiles, and we see now that the fleet of automobiles is significantly cleaner than it was 20 years ago, partly because there's a will of people to drive cleaner vehicles. And the technology as well has come a long ways to make all automobiles cleaner in the last 20 years.
The other is to have health in all policies, and when we look at what we're doing, to really look at it from a health lens. And I think that's changed a lot of the discourse through the years since I've been doing this work, is to really, when you're planning on doing something, and the port, a lot of the mitigation funds that also funded some of the air filtration in our area was because they were creating new things, and they knew that it may or may not have an effect on the air quality, so they put aside some mitigation funds. So I think seeing that health in all policies is extremely, extremely important.
And on the clean vehicles, so at KPCC, we actually were trained by Carla and her team. And Carla, I wonder if you could even just bring the P-track so we could maybe show it. And while she's grabbing that, we ended up doing a bunch of different preschools that, from just a pure mapping project, were located very close to freeways. And then we decided to do a control site on the advice of Professor Aval. And we decided to do it right near KPCC. So we thought, we're located in Pasadena. Let's see what our air is like. And while there was like a lot of traffic going by, there was a preschool a couple blocks away from KPCC. The air wasn't that bad. And Professor Aval said, and it wasn't, it was interesting because there was like trucks, there was a lot of things going by, and he said it's the quality of car. Look, these are all newer cars. Look at what's going by. They're not emitting. And he said in low-income communities, who's buying used cars? What kind of vehicles are people getting around in? They're the older vehicles. They're more highly polluting. So what are some strategies around that? And Lou, I'm going to throw that to you in a sec, but let's let Carla give us a little demonstration here.
This is the equipment that Scott was referring to. It's a ultrafine particle counter, the very tiny particles coming out of the exhaust. And so we've worked with many community partners to help them measure what's going on in their neighborhoods.
And this one, including KPCC, this is a really interesting because I'll just tell one quick story. I was telling this to our panelists earlier. When we got trained, we went down. We were down at Long Beach, and we were kind of getting our readings and taking notes and diligently trying to do everything right. And then they had said, Carla, I think, said to us, just do some tests in some other places. So we kept it running as we got into my car. We're on the 710. We're driving up to East LA to our next site. And the spike goes way up, like way through the roof. And we were just like, whoa, what's going on? It was a hot day. We had the windows up. I had the AC on, and we just couldn't really figure it out. And then I realized that I had my car set to recycle air from outside in. So we were like, oh, okay, we realized what it was. Let's turn that off. So we turned that off. It took 40 minutes for this reader to drop down to the level of when we were at the preschool. So it just that was very instructive for us as to, maybe there are a lot of people who don't even know that you should have your car not set to recycle, bring the air from outside in, or you just don't think about it. And using that machine was the first time I realized I'm in my car and I'm trapped in bad air.
Definitely.
But I want to comment. Carla worked with the Long Beach Alliance for Children with Asthma, and I think one of the roles was not only tracking, but really it was such a concrete way to educate our community about the air pollution. And I used to worry because they were standing above the freeway. I'm like, oh my God, they're breathing all this air. But I think what we created is this army of advocates to go and speak about this. And really, it was their work with Carla and Andrea's, the grant that they had to do this, that really has been very effective of taking the parents of children whose asthma was poorly controlled that we work with our community health workers. So we engage them on that one-on-one education, then educated about asthma in general and air pollution, and actually they became P-Tracker. They were our A-team. And then they are the ones that come and speak at City Council and fly to Sacramento with me, and they're some of our best educators and advocates. So I think it's a really good way to engage your community, and just like you're doing with your little...
So if any of you out there want to figure out the air, come and see Carla, because...
Yeah, it's different when you see it yourself than to have someone tell you about it, what it's like. So with this equipment and the low-cost sensors, I think, that's where you start the education piece, and then bring in the question of what you do from there.
It's the activating piece for the community, I think, in many ways.
So we want to be able to take some of your questions. Thank you, Carla. And just really quickly, before we take a question, so Lou, when you are working in the community and you have these issues of we've got so many other things to worry about, we've got all these kinds of things, yet we know that it's really bad. Have you guys been a part of anything that has made a bigger change that has impacted the broader community, or do you know of any that have in your community?
Well, I mean, we had the signing of the Clean Up, Green Up zoning map, which I think is a really good first step to start addressing kind of where you're putting industry too close to residential. So that took years. And actually, Ramona Gardens was not included in the map, so we had to advocate to get it included in the map, despite the fact that the community was surrounded by pollution. So I think land use and zoning is a good tool. Even around Ramona Gardens, there's also a lot of industry that used to be more, it polluted more in a sense that there was like refineries and plating companies. Those moved out. Now you have warehouses, which you would think that would be better for the community, but now we're counting semi-trucks coming into the community, dropping stuff off. So the community doesn't even notice the semi-trucks. We took the community out to count semi-trucks in the neighborhood, like not in an industrial area, in the neighborhood. We did 20 minutes. We counted 20 trucks that were coming into the neighborhoods because now it's the kind of warehouse type use. So I think long-term land use planning could be a good tool. I know there's places like in San Diego, in one of the poorer neighborhoods, that had the city move out some of their some of the factories that were polluting the most, and the city paid to move them out of neighborhoods. So there's things that have been done, but I think it just takes a lot of awareness and building support on the ground to push the policymakers. And there's like the cap and trade funds too, that I think that should be coming to communities to do the weatherization. And in our neighborhood, we talked about the cars. everybody has multiple cars because there's large families living in these units. So how do you get people to walk? So there's an issue of safety. So make the community greener, safer. You get people to walk to the store versus drive to the store. So there's a bunch of different things that can be done if there's a kind of coordinated effort to plan these communities in a better way.
And I think one of the other things that needs to happen at the same time is data collection, because I think for a lot of the policymakers are like, well, what's the data in that specific area? In parts of San Gabriel Valley, I mean, when you're talking about what is air pollution, that's just extrapolated data. There's not actually sensors all over San Gabriel Valley. So I think for us, kind of like a dream that I have is that, you know, we have a lot of these different sensors throughout all the different schools in San Gabriel Valley, at least in San Gabriel Valley to start. They're all in the same network. You flip a switch, and every single day you have data all over San Gabriel Valley. What is the air pollution level like today, right? And over time, we're collecting more and more data. We can see, you know, we overlay other health data on that. What is happening between air and, you know, public health and all these other things, right? I just feel like, you know, that's something that we need to have happen, because we need to create our own data to make sure that our voices are heard.
Doesn't sound like such a hard project.
So if I can just add to this, I mean, we're in a really exciting time right now where we're contemplating new studies that are going to involve the kids collecting data on themselves. And it's all because of these things here, where we are going to be outfitting kids with cell phones that are going to be continually tracking not only where they are, but their physical activity, whether they're running or playing sports, and then also through Bluetooth, we'll be able to do things like collect a lung function measure on them through a little device every couple hours or what have you, and ping them to get some health data. How are you feeling? Are you coughing, et cetera? And so we're on the brink, I think, of being able to generate not only a lot of good exposure data, but health data that will go along with that, collected by the kids themselves, which is really cool and much cheaper than how we've been able to do it in the past. These cell phones are much cheaper than some of these devices that we've been talking about.
Okay, so questions? I definitely saw some hands go up. And if you can identify yourself too.
Sure, my name is Fred Simmons. I actually work in Boyle Heights in high school there. Mendez High School, yay. Anyways, getting to the data piece, assuming that you can get your hands on a $5,000 P-track, what levels are we talking about here for ultrafine particles that are dangerous? I mean, I was looking at the count here, and it's 88,000 in the atrium. I live 40 meters from a freeway, and it's 8,000 in my living room. So how do we figure out what's dangerous for us?
I mean, that's why we do very large-scale studies, just to answer exactly that question. So for a lot of the criteria pollutants we talked about earlier, PM2.5, PM10, the larger particles, those are monitored routinely by very good quality instruments, and we have a good sense for what those are across communities, and that's allowed us then to try to link that to health. Things like ultrafine particles, it's a little more difficult. You do get into some of these devices that do cost $5,000 each, and it hasn't been possible for us to deploy those on our cohort of 11,000 kids and have them track themselves. So it's a little harder for ultrafine particles to find direct links, but we do know through a lot of studies that proximity to roads, and we know roads are associated with ultrafine particles, comes with adverse health consequences. So, and a lot of laboratory work where you can control the environment showing ultrafine particles are a problem. But I mean, it's a good question. Exactly what levels of ultrafines are when we start to see health effects? That's a difficult question that I think is still left to be answered.
And is AQMD monitoring that, or and EPA requiring that for the ultrafine yet? Because I think some of the other ones, 2.5 probably wasn't monitored when I was a child in Inglewood, where there was a lot of pollution.
Yeah, so ultrafines are not one of the criteria
Yeah,
pollutants.
so how do we get them to be a criteria pollutant?
Yeah, well, that's difficult, and maybe I'll open it up to Phil, who might want to answer this. But you know, it is difficult to measure these, and they are very local. So, for example, up in one of our relatively low pollution communities, Santa Maria, which is up north of Santa Barbara, we did put out some kind of pilot testing for ultrafine particles at the fixed site locations where we had been monitoring all the other things. We saw these very high levels in Santa Maria, which is an otherwise fairly clean environment. Went up there, and it turns out that the site is very near a Burger King, and we were basically getting the hamburger emission effect there, which was not what we were after, obviously. So you have to be real careful with ultrafines because they are very local and very spiky within a community, and it's hard to get a good read of what people are breathing on average.
So we're just going to get a microphone to you. If you could just wait one moment.
Thank you for that answer. And I think we should remember that there's not a number at which air fine particulate particles become hazardous. They're all hazardous, whether they're 0.2, 0.1, 9, 0.11, 0.30. I mean, let's not get our research-based way of looking at things to blind us to the fact that all ultrafine particles and ultra-fine particles and fine particles are not good to breathe, and they do damage to your lungs. But otherwise, I see a lot of ultrafine particles that are the result of emissions. I also see a lot of, maybe the majority of ultrafine particles that are a result of negligence in terms of people's, like you just have a rainstorm, there'll be runoff, and there'll be a giant pile of sandstone or whatever it is, and being run over by a car. I mean, this is unnecessary stuff, and stuff that's not cleaned up on the street. The street cleaning machine actually doesn't, I think, improve significantly the amount of pollution that's sitting on the streets and blown up every time a car drives over it.
So we
trash
have
cans.
Do you have a question for the panelists? We have quite a few folks who would like to
Thank
get
you
a
very
comment
much.
in.
Do you have a differentiation between ultrafine particles that are silica-based or petrol-based?
So no, we don't really have a lot of data on that. It's certainly true that the chemical constituency of the particles becomes very important, especially when you get down into those ultrafine fragments. And there's definitely a lot of research that's been looking more in laboratory kinds of settings at those constituents and linking things like naphthalene or benzoapyrene, which are particular chemical constituents of particles, to adverse health effects. And that's the other kind of complicating factor, is that not all ultrafine particles are created equal when it comes to health effects. And so, you're going to get different kinds of health effects from automobile emissions compared to truck emissions compared to, resuspended road dust or something like this.
If you could identify yourself too.
Sure. My name is Graciela Geyer. I work for the Sierra Club, and we have a campaign around climate justice, and we sort of see this air pollution as climate justice because so much of this pollution is fossil fuel based. And if we didn't run our cars on fossil fuels, if we didn't have power plants running on fossil fuels, a lot of the sources of the pollution would be gone. And obviously for people with toddlers, that's not a great answer because that's not going to happen tomorrow.
So what are some of the solutions, or what are your campaigns? What are your demands?
Well, specifically, the amazing thing, I've only started recently in this job, but I learned that in Southern California, the Air Quality Management District, and they have some amazing scientists at the Air Quality Management District and incredible professionals. But unfortunately, what people don't know, similar to the EPA, is at the end of the day, the decisions that they make are political. So just like the EPA is not going to be great if the president isn't believing in climate change, for example, that goes for the AQMD. And so that a lot of our work is just educating people about who actually makes these decisions. And like you had mentioned, really a lot of insightfully, I believe, is that things don't just happen and they aren't the way they are just because that's the world is. It's because people change things that the air has gotten better. And unfortunately, Southern California has never, ever been in compliance with the Clean Air Act, and not a lot of people know that. But there are reasons for that and policies, and we've got to educate each other about it. But I have a petition if people want to get involved.
Okay, great. So come and see you afterwards with another.
My name is Isaac Newton, and really. Free autographs, please. Okay. This is a very, I drove all the way from Rancho Palos Verdes for this meeting. The reason is, this is a issue that's very close to me for two reasons. One is I grew up in India, where there's so much of diesel particulate soot pollution combined with gasoline pollution, combined with the dust, combined with the heat and the sweat. And my two of my siblings, my sister and brother, used to go to the hospital for breathing problems, sometimes in panic, attacks, really. They had to be rushed to the emergency. And so this is an issue that is a very big issue back in the third world countries. And discussing here, if you say this is nothing compared to, but still this is a big problem because of the diesel, as you're talking about the particulate emission. So I was doing, when I was doing my master's in engineering, I did air quality studies, I was reclaiming coal fields in Illinois. And to see it is a major issue that measurement, as you mentioned, is indeed a very big problem. So now I'm the president of a company called Green Tree, and we have launched a new solution to this problem, where, it's a patented product, talking about technology, I think you mentioned about technology, where we can reduce up to 98% of the diesel particulate emission. It's a patented US invention, and we are trying to discuss that with the different levels of government here.
So it's an air filter?
No, it goes into the fuel, diesel engines. And it has been proven for the last 10, 15 years in other states. They're using whole fleets of buses have taken advantage of this, and the emissions has gone down by up to 98%. So that is one issue in terms of that is technology available today that can be used, leveraged to, instead of shutting down the 710 corridor, which is impracticable to do that. But if there is a political will to address the issue, not only from a political issue, but also from a technology issue, a perspective, then we could definitely solve these problems. That is from the outside air quality. From inside air quality, so my wife recently, we have the same issue of trying to clean up the air inside, even though the place where we live is relatively very clean. But so while studying this pollution issue, we found that people live almost about 20 hours, approximately, inside the house. So what we breathe inside and the air quality inside the house is really very bad if you do the measurements, the particulate emissions. So what we say when we say, okay, you got to vacuum, that is a solution that people offer. But we shed so much of our skin, like every 90 days, you almost 2 or 3, 4 pounds of skin. That is practical knowledge. How do you solve that problem? But most of the filters or the vacuums don't solve the problem. They just recycle it, they pick it up and throw it back into the air because, from an engineering perspective, there should be an in, there should be an out, and there's a filter in between, right? So my wife found a new solution of a beautiful machine, which is filters through the water. And so what happens, the water traps the particulates, and the air that comes out is so much cleaner. And so to solve that problem of internal air pollution, we are breathing really clean air. And then combine the technology for the diesels, and also this works also not only diesel, but also for gasoline engines. And we can solve this problem. It may not be a 100% solution, but at least we can, I think, arrive at somewhere between 80 to 90% of the particular reduction.
Yeah, no, thank you. And I think it gets to the first question that we had of, I think, many people who live right in what do you do in your own home? You can't clearly afford a very expensive air filtration system. Is there any technology along those lines that any of you are aware of that, I want to keep my own apartment or my own home protected? Is there like a personal low-cost solution?
Not really. I think obviously if your windows are open, you're going to be taking in a lot more of the outdoor air. So if you are heavily impacted by local roads, keeping your windows closed should help a little bit. But the smallest of particles and gases, of course, are going to permeate under doors, through windows, et cetera, and that's not going to be particularly effective.
But also, if you leave everything closed, then you have molds growing because you're going to be taking your shower and you're going to have dampness. You're going to be frying your food and cooking your food, so you're going to have the indoor smoke. So, actually, when our community health workers go in, they many times say you need to open your windows, preferably at the times when the trucks aren't going by, to really clean out that air. Because if you have a sealed tight home, that's not going to be good either. So it's
Yeah.
really a balance, as everything we talk about.
And so I did hear from, from yourself, from other people in the aftermath of this reporting, that it does seem like that there are some companies working on technological solutions, personal ones. We got some questions coming in from Twitter, so I just want to be able to give them a moment. And Lou, maybe you can answer this one. And this is from Wise Latinas Linked. Are kids more in Latino areas of LA being affected, or more so than other children with poor air quality?
Wow. I didn't do the research, so I couldn't compare, across communities. But I think if you just look at Boyle Heights and you have like the 4 major freeways that go through Boyle Heights, so I would say yes. We have the 10 freeway that goes like probably right by Marquepo High School, but we have 4 of those. We have the 60, the 10, the 5, and the 101 that run through Boyle Heights and next to schools. So I think it is a big issue. It's a big public policy issue in our community. The poorer the community, I think, the bigger the issue is. But I think that one of the things that we can do, what I've learned in working with parents, is that when you tell them, even when you're working on obesity issues, nutrition, when you tell them, you need to lose weight or you need to do this for your health, they take it in, they understand it. But when you tell them you need to do this because your child's health is in danger, is at risk, they tend to prioritize it as an issue. So I think that we need to bring more awareness to schools. I think LUSD should be investing in air filtration. I mean, there's funding for capital improvements, but I think it has to be part of the narrative and the conversations with parents and policymakers. So it just becomes something that is done automatically.
Yeah. I see another USC professor sitting here in the audience, Esther Margolis, and I wonder if you could just tell us very quickly. Esther came by KPCC last week, and you're an urban architecture professor?
I'm a professor of landscape architecture in the School of Architecture.
And I found really fascinating, maybe you can even shed a little bit of light on this question, because what one of your students did was almost this exact project of take maps of where, 500 feet, I think that was the other question from Wise Latinas Linked, what's the safe zone or the safe distance? Well, we know that 500 feet is not a safe distance, but maybe you could just very quickly show us the map, and I think that's where you can see, who lives around the areas where some of these are, So
I think with the tools of geographic information systems that my students are using, we can actually unlock and reveal some of the mysteries that we're talking about in terms of the vagaries of who is impacted and how can we narrow it down to know whether it's primarily affecting Latinos, Asians, or other minorities. So this is a very quick map that one of my students created at the end of the fall semester, looking at air pollution impacts specifically on schools and parks within 500 feet of either side of a freeway. So he used a 1,000-foot buffer zone, and now through GIS, we can tell you exactly who is in the impact zone of the freeway. And Lou, I think you're absolutely right about land use as being such an important tool, because if we look at the technology and we can solve it from a technology standpoint, then maybe we're 10 years away from making things safer, and within those 10 years, we should absolutely, I didn't want to say this, I can't believe nobody has mentioned the F word today. Is this not the Flint of Los Angeles? I mean, this is absolutely, between motor vehicles and Caltrans, our highway agencies, this is an avoidable situation. And when we use land use to say these are not safe zones for housing, schools, and parks, then at least until the technology catches up and we can make them safe, we should not be having people building schools, living, and especially having daycare within these zones.
Thank you. And I think one of the things that there is a 2003 California law that prohibits public schools. It doesn't specify preschool or private schools, but it is public schools cannot be built within, new public schools cannot be built within 500 feet unless they get a clearance based on a set of criteria. So there's a rather large loophole in that law, but preschools are not included in that. So that just one of the public policy answers.
I have a question for Dr. Goddard. If poor air quality is causing...
Just one sec.
If poor air quality is causing major health problems, and major health problems cost a lot in medical bills, wouldn't, in the long run, the more cost-effective solution would be to implement air filters at elementary schools and preschools?
It certainly sounds so to me. I mean, I would certainly be on board with that. I think part of the problem, though, is that those health costs get borne by the families, and so they kind of go maybe unnoticed, and they're not part of a state or a federal budget when you think of that, whereas putting filters into schools are going to be part of the AQMD budget or something like that. It's going to get a lot of notice. But yeah, if you've got a family that has a child that develops asthma and they're on medication, it can be $700-800 a month just in medication costs, on top of the other costs that they're having to pay for and thinking about putting food on the table or what have you. It can be a huge economic burden to a family and to a community. So I absolutely think that when you run the cost-benefit analysis, prevention is much better than trying to deal with it after the fact. Good point.
We only have a minute or two left. I know we've got two. Can we make two quick questions?
Hello, my name is Mary. I actually work at Keck Medicine in Boyle Heights. But I was curious, in the various neighborhoods where you guys have been doing advocacy, how much pushback you get trying to improve air quality regulation and balancing that with industry, because closing down freeways and warehouses employ people, factories employ people, and how governments and even just community members who are employed by these, kind of weigh that out.
Elisa, you may have dealt with some of that in the port stuff. Can we have the thumbnail sketch?
Well, I think we just have to message it properly. I think most of the work that's been done has helped people get to work more, had parents miss less, work because their kids were in school and they weren't calling out sick. There have been new industries that have developed because of the cleaner air technology. So I think it was on the call we were on, Andrew, I don't know, that someone mentioned that actually cleaning up the air actually is better for the economy than not cleaning up the air. And I think that's the message that we need to get out, and we need to have our talking points so that we can go there whenever people start questioning that.
I went to the Long Beach City Council hearing, and I wanted to see who opposes this, who's the opposition to this, and it was a very interesting, the kind of more obvious, the ports, the truck manufacturers. Interestingly, the unions. There were union speakers who stood up, and so I think there's definitely, it's not a slam dunk case, and I don't think Elisa would say that, but there's a lot of work to be done, and I think that the realistic, the reality is that you have to find an alternative way, because this is the goods coming in. So the solutions are complicated. It's not, I think that. Just to put that there is this is who some of the opposition is. When I talked to Mark Lopez, who runs a group called East Yards Community, which are pushing for a corridor on the 710 to be zero emission diesel trucks, he said Caltrans is the big opposition to that. That Caltrans is the one who they're really having to get on board. So I think the opposition. And he would say we need to listen and sit down and take seriously so we can come up with solutions together. So just a quick one. I think we had one more question back here.
Sorry. Hi, I'm Mary Jane Puffer with the LA Trust for Children's Health. We're a nonprofit that's affiliated with LAUSD school wellness centers. We're doing some asthma prevention programs. So I just wanted to echo this thing about educating. So the students and the staff at Carson High School just wanted to work on some remediation in their local community. So the buses were idling outside of the school, and they went and told the bus drivers, hey, we're getting asthma. We have asthma because the buses are idling. The bus drivers had no idea. So they were cold, so they were leaving the buses on, and so what happened is they shut the buses off, and they were invited to sit in the wellness center while they were waiting. But I'm really interested in the student research idea you said. That was very exciting. We work with youth advisory boards across the wellness center sites, and I think that they have the power to take it, so thank you.
Yeah, it's exciting.
Okay, well, unfortunately, So we are at time. We're actually cut off from but the panelists will be around. So if you want to ask a quick question, I think some of our audience members also are very, very expert on these issues. So, if you have a question, please do. I want to thank so much, first of all of you for coming out on a Sunday afternoon, giving up your Sunday afternoon, and to our panelists, to Luke Kalanche, who is from Legacy LA, to Scott Chan from the Asian Pacific Islander Obesity Prevention Alliance, to Jim Gorderman, who is with the USC Keck School of Medicine, and Elisa Nicholas, pediatrician with LABACA, the Long Beach Alliance for Children with Asthma. Thank you all so much. And I also just want to thank Charlotte Duran, who is with the KPCC in-person team, who has done all the hard work to put this together. Charlotte's great. Thank you so much, Charlotte. And of course, to our technical team who has been live streaming this, thank you all very much for making this possible. And kpcc.org/in-person is the place. There are many more live events like this, so please do spread the word in the community. And Ashley Alvarado has left behind the little notices on your seat. Become a source. We journalists, we reporters at KPCC, we want you in our stories. We need to hear from you, so take them back. Have your mom, have your sister, have your aunt, have your teacher fill it out and get it back to Ashley. So thank you all very much.